The CDC is urging millions of Americans to put on face masks now indoors, even if they're fully vaccinated against COVID-19. So here to talk about that and so many other things, because this continues to evolve very quickly, is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health.
Great to see you, Doc, as always. So these are new federal guidelines. They apply to communities with high infection rates. So this is a two-part question. Right. Are there any of those here in Massachusetts or in New England?
So, hi, Ed. So depending on the definition, when you look at high levels of transmission, that's 100 cases per 100,000. There is one in Barnstable County. And then when you look at what's referred to as substantial transmissions, that's 50 cases or more per 100,000. There are a few counties, Bristol County and Suffolk County. So we'll have to see. Right now, the Department of Public Health is looking into this right now. There's active investigation to figure out how to digest the CDC guidance.
And then we'll probably then we'll find out from the state what we'll have to do based on our counties and where we live. Yes,
exactly. But more importantly than that is we know that as cases are rising, we want to have added layers of safety, especially for compromised individuals, elderly, people that are at high risk for severe outcomes. We want to build in that extra layer of safety.
Right.
So we don't need to tell you, but we all know Massachusetts is doing very well, second highest vaccination rate in the country. So why are we seeing these numbers increasing, and are vaccinated people spreading this virus as well?
Right, so Marie, we are doing so well. 2/3 of the state are fully vaccinated, but that still leaves about 2 million people in Massachusetts that are unvaccinated. So that combined with an amped up virus, you know, those things are leading to increased cases. But the increase in Massachusetts is significantly less than most of the other states in the country. As far as vaccinated patients spreading the virus, we don't know as much about the viral dynamics with transmission with Delta. But it does make sense that likely you can spread the virus even when you're fully vaccinated. But, and the big but is, this is still mostly being spread by unvaccinated people to other unvaccinated people. And then there are some vaccine breakthroughs.
Right. Oh, and that's a good distinction, Dr. T. Thanks for that. Now, we're at the end of July, right? We're heading into August. Schools are going to be opening up. So the other headline today is the universal masking inside schools. The CDC now wants everyone K through 12 to wear a mask this fall, regardless of their vaccination status. Obviously, K through 12, well, some plus than the other end of it would be vaccinated, perhaps. So do you agree with that? Do you agree with that decision by the CDC, K through 12?
I do agree with this. Why? Well, first of all, even when you look at the 12 to 18 population, only about 35% are fully vaccinated. Under 12, there's zero, right? So It makes sense. Also, it's difficult to know in school who's vaccinated, who's not. I think these added layers of safety, what it will do is keep our kids in school. It will keep our businesses open. I don't want people to think of this as punishment. I think the masking, in addition to vaccination, is our best way to get case counts down, and we know that that's best for all of us.
You're not just a doctor, you're a dad, you have 2 teenagers. So what are you telling them right now about wearing a mask?
Okay, my boy is at summer camp right now, overnight camp, so I'm not telling him anything. You know, and certainly when they're outdoors, and he is fully vaccinated. So, you know, when you spend your time outdoors, I don't believe that we need to mask. But you know, the bottom line is this. I think that it's important that we carry our masks, you know, near us right now, even if you're fully vaccinated, because if you're in one of these counties that's having higher levels of transmission, if you're immunocompromised, if you're at risk for more severe disease, this is something that you want to put on when you're indoors, especially if you're in crowded areas.
Until when? I mean, I guess, I don't know. I know you can't answer that question, but first it was, you know what, you don't really need to wear the masks. And now we're saying, no, you need to wear the masks again. And it is a difficult thing to keep up with. And I know that it's hard because there's a lot of unknown here.
Look, I'll be the first one to say, I was thinking that this conversation we were going to have was going to be in a few months from now, in the fall. You know, it's unfortunate that it's hitting us in the middle of summer, but the bottom line is the Delta variant does not care. This is on its own trajectory, and the only ways we can stop this is by, you know, staying away from crowded areas, masking indoors, getting vaccinated, of course, being the most important. I really urge, you know, everyone in the Commonwealth who's not vaccinated to please consider it now.
Dr. T, thanks for your time. Great to see you as always.
Thank you, Dr. Ellerin. Be well.
10 minutes before.